Ladies and gentlemen, it's my honor to be here to introduce our technology regarding to biofabricate the patient-specific tumor-on-a-chip system for medical prediction. Here is my CV. My name is Yiwen Chen from the China Medical University. My expertise is additive manufacturing, bioprinting, and organ-on-a-chip. Here comes our team. We have very deep collaboration with the National Tsinghua University, National Taiwan University of Science and Technology, and of course, China Medical University's physician and the researcher. We are very lucky to receive several honors, awards, patents. We also tech transfer our previous tech to industry. That means our team is focused on how can we transfer our technology to industry. Today, I would like to talk about the cancer treatment, especially the unmet need in lung cancer. In lung cancer, we have the precision medicine, which called target therapy for EGFR TKI. If patient has been detected the EGFR mutation, the physician will give him or her the drugs of the EGFR TKI. But the target therapy only responds for 60 to 17% patients, which means there are 30 to 40% patient is not responsive for the EGFR TKI. So if we have a precision in vitro cancer model, that we can predict the drug screening result. So that will be more precision for the patients. There are several different in vitro cancer models we have considered. But the best in vitro cancer model need to achieve the cost-friendly, can be high throughput, and traceable system. So our answer would be tumor-on-a-chip. Before we talk about our technology, I would like to introduce the tumor microenvironment. The tumor microenvironment is very complicated. It's not only cancer cell. It includes several systems like blood vessel, like immune systems, like fibroblast, ECM, and so on and so forth. And microenvironment need to consider, the tumor microenvironment need to consider the hypoxia gradient. So based on those parameters, we need to consider the requirement of tumor-on-a-chip. We need to biomimic the microenvironment, including all the systems. And the chip need to be easy to fabricate, easy to perform the quantitative assay, and the result should be rapid and high throughput outcome. So the first technology I would like to introduce is we are able to fabricate the multi-size cell microvessels in various sizes that help us to control the size of cell cluster and to control the cell number, which means in the future we are able to provide the precision report to the physician or to our patients. And we have two systems to be developing in our group, which the first one is the organoid, which contains like 90 to 95% of cancer cells. But as we have mentioned, in tumor microenvironment, it's not only cancer cell. We talk about the multi-cell cluster. So we have the second system is called cell block that we contain several different patients' primary cells in together. So when we combine the two systems, it can be more similar and more biomimics to the patient's real tumor. So here is the image that we put our organoid in the middle, and we surrounding the different cell systems like a cuff, like a HUVEC, and the immune system together. And then let them two cells self-organize and let them two self-mature. Here is the image from the microscopy. We can see the vessel has formed the tubes and penetrate into our organoid. So our in vitro system, our tumor-on-a-chip is really similar, really biomimics to the patient's tumor microenvironment. Not only the microenvironment, we also consider how to produce, how to fabricate the whole system. So we has developing our automation equipment, which is a bioprinter, that it can automatically loading our ECM, our cell cluster, and our surrounding cells, and they then self-mature, they then self-organize. And after we loading those components into our 96 wells, and they will mature for a few days, and then we're using the drugs onto those systems to see the life of days of cancer cell. So here is the analyze procedure. So we treat those in vitro model with the cancer drugs, and then we're using the standard stand for the axis. We're using a microscope to observe the cancer life and death image, and then give the report for the cancer viability to the patients, to the physicians. Here comes our clinical result. We have done 24 lung cancer patients, and we have reached the 87% accuracy, 88% sensitivity, and 85% specificity. That means our in vitro model is really similar and really high response to the drug's efficacy. And we also analyze the patient's tumor sample and our tumor-on-a-chip. We analyze their gene profile. We analyze the distribution, and we find out they are really similar to each other, and they have the similar cells distribution to each other. And the most significant case I would like to raise here is we have one patient. When this patient has been detected, he had a lung cancer in January, and the physician gave him the protocol treatment, which is carboplatin and carboplatin and Anita and the other so on and so forth drugs to treat him. However, after 2 months, the disease didn't control. The lung cancer become serious. So that means these drugs cannot give the very good treatment to the patients. And then our CHIPS outcome comes out. Our CHIPS outcome shows this patient need to using the cisplatin and the other drugs combination to help him. And the physician take this advice, and then they change the strategy to treat this patient. And after a few months, we find out the disease has been controlled. The cancer's area that we can observe from the CT image. The white area in the red circle is the original tumor. And after a few months, we find out the drug has been effective. And then the tumor has been shrink and reduced. The patient's disease has been controlled. And we find out if we can give the very precision prediction before the treatment, we are able to prolong patient's life. We are able to give the better treatment to the patients. So that will be our end goal for this in vitro model. Our tumor-on-a-chip is able to help the patients, the physician, to before they doing the wrong decision for the treatment, that we are able to help them to give the very right decision in the very beginning. So that will be the whole presentation for our technology developing. So I'm very thank you for everybody's listening.